Hi, this week I'd like to talk a little bit about Lyme disease. It seems pretty timely given that it's springtime and we are starting to think about getting outdoors more often, spending some time going out for walks, possibly taking our pets outside, getting some exercise. When we do, we're going to come in contact with ticks. Whenever the weather is above freezing, so 35, 40 degrees or warmer, you can see tick activity. The deer tick is the one that we're most concerned about. It's called the deer tick because its primary host is deer. And they travel with these ticks on them across state lines, across county lines, and they pick up these ticks and travel with them and drop them off, oftentimes in the woods and backyards that we spend time in. These ticks can feed on, in their early stages, mice, chipmunks, ground dwellers. Their next life stage might live on smaller mammals such as a raccoon, fox, turkeys even. In the adult stage, really like deer, but they also can bite people. That's how we get Lyme disease, but they can also jump on your dog or cat. Now, we don't really see clinical Lyme disease in cats, so we don't really talk to cat owners about this, but it is certainly a problem for our dogs. Ticks need to be attached for about 24 hours before Lyme disease can transmit. So most of our products on the market are going to be great at killing ticks within that time period. The best ones on the market right now are the medications that you give your dogs once a month, chewable oral products. There are some collars like a Seresto collar, which can be good, but some of the older products that are sold over the counter in pet stores, Frontline, Advantix, those aren't as good as we once thought they were. They don't consistently kill for an entire month. So there's a risk that ticks can stay on long enough to transmit disease to your dog. The next thing that you need to think about is after every walk, you want to do a tick check and remove those ticks as quickly as possible. The ones that we tend to find are the ones that are kind of blown up and looking kind of grayish brown. Those are your adult females, and when they start to blow up like that, they've been on your dog for at least 24 hours, if not longer. So the ones you're looking for lay flat against the skin. They can be hard to find. They're going to most likely be up around the face and neck, sometimes on the underside of your dog. So taking them off. But the other thing you should seriously consider doing is vaccinating your dog against Lyme disease. There's a lot of information out there about vaccines for Lyme disease. The older vaccines prior to, say, 2010, 2011, were not really good at preventing Lyme disease, but new technology comes along and we discovered how to make these vaccines more effective. Vaccines do work. And in my patients that get Lyme vaccines every year and use their tick prevention all year round, not just in the summer, we actually really don't ever diagnose Lyme disease in those dogs anymore. But what happens if your dog does get Lyme disease? Only 5% of dogs actually show symptoms of Lyme disease. Limping on one leg, stiffness, achiness, not feeling like themselves. But the majority of those dogs are making antibodies, all dogs are making antibodies to the organism, whether or not they show symptoms. And in dogs, those antibodies can be problematic. We do see dogs develop damage in their kidneys as a result of being exposed to Lyme that goes unnoticed and untreated. So dogs that do test positive for Lyme at some point in their lifetime, your veterinarian may recommend follow-up tests like antibody titer testing or urine screening or blood tests to look for function loss in your dog's kidneys, because that is a real risk. And just this past year, I diagnosed a 6-year-old dog with Lyme disease-induced kidney failure, and that dog lost her life. So it is a real problem. So please talk to your veterinarian about the best tick products for your dog, vaccinating your dog if they've never been vaccinated before.